What is your take or your perception on this whole Instagram, social media, perfect girl image versus real life?
It's really interesting. I get to see more images on social media, specifically Instagram, every day as part of my practice, because my new patients and repeat patients or established patients use Instagram to show me examples of what they consider to be either ideal results, their goals, or results that they like. And what I've noticed over the last few years is that the concept of what a good result is becoming very distorted. And it's almost gotten to the point where aesthetic principles of what is beautiful has been really, really distorted and changed in a way that is unattractive. Some patients believe that bigger is better, period. We kind of saw that in the 80s with breast enhancement surgery, where patients got huge implants. You saw the implants getting bigger and bigger and bigger. And then now my patients that were in their 20s back then are now in their 40s and 50s, and these big breasts just do not serve them in their present lifestyles. You know, I believe the same thing is going to happen for gluteal enhancement, butt enlargement surgery, where it was big, it's gotten bigger, and now it's gotten to the point where proportionally and aesthetically, the proportions just are not appropriate for many of these women's frames. And what these patients do not either understand, refuse to accept, refuse to understand is that this is a living graft, especially when you do it with fat. So when you gain weight in the future, that will continue to get bigger. I think you're going to see some very shocking things in the next 10 or 15 years that are the unwanted after effects or side effects of this procedure. Personally, I won't do it.
So if I give you a check right now to get my butt done, you won't do it?
It's not going to happen.
Really? And most doctors will?
Well, I don't know if most is the appropriate word, but I think that many doctors just want to make patients happy and they want to meet their expectations. But yet, as part of who we are is we're responsible for educating our patients and making sure they put patients' best interests first. The hardest thing sometimes is tell a patient no.
Of course.
And you're doing the patient a favor by telling them no. What a patient wants today is not what they're going to want 5 years from now. It's important to really have these discussions with patients. So, you know what, you're in your 20s, you're in your 30s, the life you're leading today is not going to be the life you're leading when you're in your 40s and 50s, et cetera. If a doctor does a procedure that's going to somehow limit a patient's ability to exercise, their choices with respect to clothing, it's going to interfere with their credibility in the professional world, if that's a concern for patients, you're not doing your patients a service.